within the legislature.
Welcome to TMA's Legislative Hotline for Friday, March 1st. I'm Brent Anier. We have 3 items to report this week. More progress on the emergency supplemental budget bill we talked about before, action on 2 vaccination bills to protect children, and first, red tape reduction as simple as the swipe of a card. Now, most of us are aware of all the forms patients have to fill out when they arrive for an appointment. Well, this week, the Senate Agriculture, Rural Affairs, and Homeland Security Committee passed Senate Bill 166, one of TMA's important red tape reduction bills, which would change that. The law would allow physicians and their staff to check patients in using the electronic strip on the back of their Texas driver's license. Office staff could swipe the patient's driver's license to copy demographic information like their name and address, meaning less paperwork for the patient and less transcription for the office staff.
The efficiencies that can be gained by technologically adding demographic information to the electronic medical record is substantial. In our practice, we estimate that we can save anywhere from 60 to 90 seconds per patient that comes into our facility. Multiply that by the hundreds of thousands, if not millions of patients who attend physician offices every year, and you can see substantial efficiency gains. And that's not just for the physician themselves, that's for the patients who don't have to stand there and fill out all the demographic information that they otherwise would were it not for the electronic stripe on the Texas driver's license.
Dr. Swift, who chairs TMA's Council on Socioeconomics, calls it a win-win idea. The bill now goes before the Texas Senate for consideration. The Senate Finance Committee passed House Bill 10, the Emergency Supplemental Budget Bill. This allows the state to spend another $4.5 billion this budget cycle on Texas's Medicaid program. The Senate will take up the bill on Monday. Also this week, 2 TMA immunization bills saw action. First, the Senate Health and Human Services Committee passed Senate Bill 64 by Senator Jane Nelson. It would require licensed child care facilities to develop and implement an immunization policy for their employees. This would prevent them from spreading vaccine-preventable diseases like the flu to the children in their care. Dr. Kim Avila Edwards, a member of TMA's Council on Science and Public Health, testified in favor of the bill. By the way, the companion bill is House Bill 1150 by TMA member physician Representative John Zerwas. The other vaccine bill targets a twist in Texas law. Currently, a minor living at home with her parents who has a baby can sign to have the infant vaccinated but cannot consent to get her own immunizations. Senate Bill 63 by Senator Nelson aims to change that. An Austin doctor got the idea for the bill. Dr. Celia Neavel, a family physician specializing in adolescent health, regularly sees young mothers who come in alone with their babies for postpartum visits and well child exams. The teenager needs her shots, but by law, they're stuck.
She cannot sign for her own vaccines, and it's very frustrating for us because sometimes those vaccines are vaccines to actually protect the baby. She can sign for the vaccines for her baby, but not for herself. So that's just a frustration I've had at work because we know not vaccinating when you have an opportunity is a lost opportunity, and you may not get that opportunity again. So it would just make perfect sense if we could have the parents who can sign for their baby be able to sign for themselves.
Senate Bill 63 would give those young parents, the mothers and the fathers, that ability. Dr. Neavel did note that if the minor with the child is 16 years or older and living away from his or her parents, currently they can sign their own consent. We expect the Senate to take up both immunization bills next week. Well, that's all of our time for now. Will you be in Austin next week for TMA's first Tuesdays at the Capitol? That's Tuesday, March 5th. And while all physicians, medical students, and TMA Alliance members are welcome, young physicians, this one's for you. You're especially urged to attend. We hope to see you here. For TMA, I'm Brent Anier. Thank you for watching. We'll see you next week.